It is the time of year most of us cope with runny noses or sinus infections. You may be one of them, and if so, here's a question for you. Do you know why? Many people write off their sinus problems as just the sniffles, maybe even allergies. Have you ever considered the problem is more chronic? And did you even know they have long-term solutions? Here to discuss all of this is Dr. Boris Karanfilov from the Ohio Sinus Institute. Doctor, it's a pleasure to have you here.
Thank you for having me.
You grew up in Central Ohio, so you know the sniffles and things that all these folks are talking about. Initially, how do you know that what you don't have an allergy, but really a chronic sinus problem that is not going to go away until you fix it?
Well, sinus problems are defined by a chronicity. So typically, chronic sinus sufferers suffer with disease for 12 weeks or greater. So that's one of the main factors. The other factor is major and minor symptoms related to chronic sinusitis. So postnasal drainage, anterior drainage, discolored secretions, coughing, lack of smell, and facial pain and pressure are all symptoms that chronic sinus sufferers have.
Especially if you have those, as you said, on a long-term basis.
Exactly, 3 months or greater.
Now, you're I have to read this, rhinologist, because
Yes.
I've never heard of that. What is it?
Rhinology is a rather new subspecialty as a part of the ENT specialty, where we spend an additional year after our ear, nose, and throat training doing only nasal and sinus disorders.
Are there more and more patients coming to you? Do you see more and more people suffering from this chronic disorder?
It seems as though with pollution, with various environmental changes,
so yeah,
we see
that
a
is
lot of
part of it then.
Yes, very much so.
Can you get sinus infections as you get older? So just like allergies, can you develop this as you age?
You can. I mean, the age group for chronic sinus disease varies from young children all the way up into 80s and 90-year-old patients. So there isn't a defined age where you can develop it. It can happen at any point in your life.
Which makes it even harder then to figure out that's what you have.
Correct.
Okay. We're going to show some video that shows one of the... Well, first of all, when someone comes to you and they have an issue, you do start with something not as invasive as surgery.
Correct.
Right?
If you're diagnosed with chronic sinusitis, the first line of therapy is medical therapy, and we like to administer maximal medical therapy, and that typically includes antibiotics, steroids, nasal washes, and a variety of over-the-counter decongestants and sprays.
But sometimes that doesn't do the trick.
But after 4, 6, 8 weeks of therapy, if your symptoms persist and you still have positive disease on an endoscopy or CAT scan, at that point we consider surgical options.
And one of your surgical options is a balloon technique, which we are going to show video of, but also a bit of a warning to our viewers: if you're squeamish or you don't like to look at blood, you may not want to watch this. But it is very interesting to see how you do this. And as we show the video, explain what we're watching, Doctor.
So this is a preoperative CAT scan. You can see above the patient's right eye a gray area, and that indicates a chronic sinus infection. So what we do is we insert a small thin balloon catheter through the narrow blocked opening, and we inflate the balloon across the opening and remove the infection. So now you can see 6 months after the procedure, the CAT scan shows a nice black open sinus cavity after performing the balloon procedure.
There is no gray there. So is it a permanent fix?
For many patients, it is a permanent fix. The failure rates can vary from 5 to 15%, but that's very much in line with the failure rates from traditional endoscopic sinus surgery.
So this is different than how other folks, even if they've had surgery in the past for their sinuses, they may not have had this procedure.
Yeah, this procedure was pioneered back in 2005 and relatively new, recently approved for in-office use as of January of this year. So it's a very new procedure.
How invasive is it? You mentioned it's in your office, so there's no hospital stay. They come and go the same day.
Right. Those patients that qualify for in-office, it's not much more than going to the dentist for a simple dental procedure.
You make it sound so simple.
It is.
And it is. And the results then are something that if people have been having chronic sinusitis, this could alleviate it for them.
Correct. For the properly selected patients, it can definitely provide relief.
Okay. If folks want to know how they can get a hold of you and what's the best way to find you, Doctor?
Online is the easiest for us, ohiosinus.com, and we have a newsletter, we have referral forms, and we have a telephone to reach us.
Is there any age limit that someone can undergo this balloon sinus?
You know, typically the 18 and over age limit is where we're looking at, especially for in-office work. However, it has been employed in the pediatric population in the hospital setting.
Well, it's very interesting, and thank you for sharing that with our viewers.
Well, thanks for having me.